people, namaste, welcome back to my channel. In previous video I discussed about the bacterial keratitis etiology and pathogenesis. Now I will discuss about the clinical features, signs and symptoms and treatment, all these in this video. See, first of all we should know the symptoms of all these are the same symptoms in every cornea have. See, corneal ulcer means pain, foreign body sensation, watering will be there, photophobia will be there, blurring of vision, next eye redness of eye will be there. Okay, these are the symptoms. Next we should remember the signs like a swelling of lid. Because of ulcer, swelling of lid occur. Next, blepharospasm will occur. This conjunctiva, cornea having at the anterior surface of cornea we have a conjunctiva, which is chemosed, hyperemia and ciliary congestion will occur. Chemosed is an important point in conjunctiva. In corneal ulcer, what is the conjunctiva will happen? What happened to conjunctiva? Conjunctiva is chemosed, shows the conjunctival hyperemia and hypercongestion. See here, swelling occur, blepharospasm will occur, and conjunctiva undergoes chemosed. Conjunctiva undergoes chemosed and showing hyperemia and the congestion will occur. Next, corneal ulceration. How this ulcer is present? What are the color of this ulcer? Generally, at early stages, the color of the ulcer is early stages the color of the ulcer is grayish white. Color of the ulcer is grayish white, circumscribed. What is the early stage of ulcer? Grayish white, circumscribed. But after the ulcer undergoes more later stages, we can see yellowish white. Corneal ulcer undergoes yellow, first grayish white, next yellowish white. These kinds of two types of ulcer, like oval shaped ulcer and irregular shaped ulcer, is also present. See, in the floor of the ulcer is covered by necrotic material is present, and they have a swollen. Margins undergo swollen and surrounding stromal edema is also present. See, in every ulcer there is an edema, the margins undergo swollen, they have necrotic material, and the color you should remember, like first of all grayish white, next converts into yellowish white. These are the signs of corneal ulcer. Should remember swelling, blepharospasm, conjunctiva is important. What the conjunctiva takes place in corneal ulcer? Conjunctiva undergoes chemosed and because of ciliary congestion and the hyperemia, ciliary body congestion and hyperemia. Next, corneal ulcer color. Next, some of the characteristic features are present. Staphylococcus, I discussed in previous video some of the organism. Staphylococcus aureus is yellow, white and oval. Yellowish white, same. Yellowish white, oval is Staphylococcus. Pseudomonas, irregular sharp ulcer and greenish in color. Pseudomonas is greenish. So irregular corneal ulcer is Pseudomonas. Next, enterobacteria, so shallow ulcer with grayish white. Grayish white means it is early. Grayish white means early. It is shallow ulcer. Next, gram negative bacilli, because by endotoxins produced, it is present in ring shaped ulcer is presented because of gram negative bacteria. Okay, ring shaped ulcers. Next, nocardia is one of the important. It has a pinhead ulcer or feathery pattern ulcer is present. Pinhead ulcer, where the pinhead ulcer is present, sometimes they will ask nocardia. In nocardia, pinhead ulcer is present. Okay, these are the some of the characteristics. What is a staph has oval shaped yellowish white? What is a enterobacteriaceae have shallow ulcer is present with grayish white? What have pseudomonas is greenish color, so it has a irregular ulcer is present. And gram negative is ring shaped, having ring shaped ulcer. Nocardia is important one, pinhead ulcer, not pin shape, pinhead or feathery pattern ulcer. Okay, wait a minute, how it present I will see. This is the ring shaped ulcer. Okay, this is the oval ulcer. This is the ring shaped ulcer. Okay, ring shaped ulcer means gram negative. Okay, next we will discuss about the complications of corneal ulcer. What are the complications of corneal ulcer? Corneal ulcer has, first of all, because of toxic iridocyclitis. Before going into the complications, we should know the symptoms and signs. Symptoms are important: easy blurring of vision, photophobia, watering, itching, reddishness of eye. All these are present. In signs, swelling of eyelids. Eyelids undergo swelling. Next, conjunctiva undergoes chemosed congestion and ciliary body hyperemia will occur. Next, first of all, grayish white color. Next, yellowish white color is present with present of necrotized material, and swollen margins are present with having an edema. Edema is also present. Next, I discussed about the characteristics for staph aureus, how it present oval with grayish white, and next I discussed about the pseudomonas. Pseudomonas is a greenish color and irregular margins are present, and ring shaped ulcer gram negative I discussed is a pinhead ulcer is present in nocardia, and another one also I discussed. What is that? Wait a minute. Enterobacteriaceae, grayish white with shallow ulcer. So these are the important points comes in the signs symptoms. Next we should discuss about the complications. Like complications. What are the complications? Complications are, first one, because of this corneal ulcer leads to toxic iridocyclitis. Toxic iridocyclitis. What is toxic iridocyclitis? Itis means inflammation. When this iris undergoes this corneal ulcer, in the corneal ulcer, purulent corneal. Generally, this iridocyclitis in presence of purulent corneal ulcer due to absorption of toxins in the anterior chamber. In anterior chamber, these toxins are come inside the anterior chamber. It leads to toxic iridocyclitis. Next, secondary glaucoma. This is important. Secondary glaucoma is present in corneal ulcer also. Okay, corneal ulcer blocking the angle of anterior chamber. Next one is discussed also desmotocele. Because I discussed in previous video, because of high organisms, virulent organisms leads to descent membrane undergoes bulging, leads to desmotocele. This because of the desmotocele, any coughing or straining or any sneezing leads to perforation. Because of perforation there is aqueous humor out. Next, decreased IOP. Next, iris prolapse will occur. Okay, iris prolapse will occur. All these are signs. Okay, all these are signs in desmotocele. Next one is, next complication is perforation of corneal ulcer. Perforation of corneal ulcer. Because of the desmotocele undergoes perforation. Next point is perforation. How it what are the things happen in perforation of corneal ulcer? When perforation occurs, see, perforation occurs because of this straining, squeezing all these muscles. Because of the desmotocele undergoes perforation. First occurs prolapse of iris. Iris undergoes prolapse. Next, anterior displacement of lens or subluxation of lens. Next, anterior capsule undergoes cataract. Corneal fistula will occur. After the fistula, uveitis, endophthalmitis, panophthalmitis. Next, intracorneal hemorrhage. How it occur, I will discuss. See, when the cornea undergoes perforation. When cornea undergoes perforation, this iris undergoes prolapse. First point is iris prolapse. Okay. Next, because of the iris prolapse, see, this is the eye, this is the iris, and this is the lens. The lens will be when they see, this is the ciliary body, these are the lenses. When the iris, all these prolapse, then there is no attachment of journals. Then the lens will subluxation or anterior displacement of lens. So anterior dislocation or subluxation of lens will occur. So these are the 2 points in corneal perforation. After this, because of iris prolapse, the lens undergoes subluxation. Next we should take this lens. Lens will undergo subluxation or anterior displacement. Next to this, anterior capsule undergoes cataract. When the lens if it is a cornea, the iris undergoes prolapse. This undergoes perforation. When this lens undergoes comes into the dislocation, anterior dislocation, this lens having some structures called capsule. These are the anterior capsule, this is the posterior capsule. So this anterior capsule undergoes cataract. How it cataract? When this perforation comes in contact with this lens, anterior capsule of lens. When the perforation comes in contact with the anterior capsule of lens, leads to anterior capsular cataract. Anterior capsular cataract when the perforation This is the lens. And the perforation occurs at the anterior capsule, leads to cataract. Next, after the lens, cornea fistula. Corneal fistula. What is fistula? When the perforation in the pupillary area, this is the iris and this is the pupillary area. When the perforation occurs in the pupillary area, it is not plugged by iris and lined by epithelium, which gives way repeatedly. Repeatedly it occurs. Repeatedly occurs. There is a continual leak of aqueous through the fistula. Then this cornea undergoes some fistula. It leads to, because of the perforation at the pupillary side, it leads to corneal fistula. Okay, corneal fistula. After this, all this iris undergoes prolapse. Next, pupil at the pupil side, it leads to corneal pupil perforation, leads to corneal fistula, and the lens under sublocation or dislocation of the lens, and when the perforation occurs at the anterior capsule, leads to anterior capsular cataract. All these are because all these structures leads to endophthalmitis. Lastly it leads to endophthalmitis or panophthalmitis. All the layers. Endo means all layers except sclera. Except sclera. Whereas pan means total all layers. All layers involves inflammation. Next, uveitis also. Sometimes it leads to uveitis. Okay, these are the points comes under perforation of corneal ulcer. Okay. Next complication is corneal scarring. Corneal scarring will occur. Scarring. Because of scarring leads to permanent vision loss. Permanent visual impairment. Permanent visual impairment will occur in this because of corneal scarring. These are the complications. First one is toxic iridocyclitis, ulcer, glaucoma will occur. Next, because of this, it leads to desmetocele. Desmetocele leads to corneal perforation. What are the points comes under corneal perforation is iris prolapse. Because of iris prolapse leads to this lens, this anterior sublocation or dislocation of the lens. If this lens, when the perforation occurs at the anterior capsule, leads to anterior capsular cataract. When at the pupillary side, this perforation occurs and continuously, it leads to corneal fistula. Because all this occur leads to endophthalmitis, panophthalmitis, uveitis occur. These are the steps comes under perforation of corneal ulcer. Next, other complication is corneal scarring. Because of scarring leads to visual impairment will occur. Next, we should discuss about the management of corneal ulcer. What is the management? First, see, corneal see, this is the important toxic iridocyclitis, secondary glaucoma, desmetocele. Desmetocele, how it occur? Because of IOP increased, it leads to bulging, leads to desmetocele. Because of this desmetocele, when there is a cough, strain, all this leads to perforation. Perforation leads to prolapse, subluxation, anterior, all these are discussed. Okay, corneal scarring will also permanent visual impairment. Next, we should discuss about the management. What is the management of this corneal ulcer, bacterial corneal ulcer? First, we should take the clinical evaluation, laboratory investigations. Next, we should treatment. Easy. Clinical means we should take the, what is the clinical? History taking, general examination, ocular examination can be taken from the clinically. Ocular examination means regurgitation test, syringing, all this should be done. Okay. Next, laboratory investigation, TLC, DLC, gram staining, all gems staining, blood agar, SD agar, all can be seen under laboratory investigation. Sometimes in Viva they will ask, how you manage means first you should take the clinical evaluation, laboratory investigations. What are the laboratory investigations? You should tell DLC, TLC, microbiological like gram staining, SDA, gems, blood agar, all these can be in Viva only they will ask. Okay. We can take the regurgitation check and syringing test for lacrimal sac. Any infection will be there. In source of this bacterial infection in previous 2 videos. In that video, what is the source of this ulcer? I discussed the sources because of lacrimal sac infection also. Okay. Next, we should discuss about the treatment. See, treatment is very easy. Definitive treatment is present, and another treatment is also present. First, we should discuss about the definitive treatment. Definitive treatment is topic antibiotics, systemic antibiotics. Antibiotics. First, ulcer will bacteria means antibiotics. Antibiotics like what are the antibiotics? Combined therapy to be given for gram positive, gram negative. Systemic means cephalosporin, aminoglycoside should be given. These are the important points. Important. What the treatment of corneal ulcer? They will ask in bits. See, fortified ceftazolline, fortified tobaromycin, fortified vancomycin, TVC. TV means tobaromycin, vancomycin, ceftazolline. You should remember this percentage also. Ceftazolline is 5% and tobaromycin is 1.3% and fortified vancomycin is 5%. What is it? 5%. Vancomycin is not 13%, it's 5%. It's also 5%. Okay, you should remember this is fortified. You should remember fortified cephazolline, fortified tobramycin, fortified vancomycin. Okay, first you should give the antibiotics. Okay, next, for non-specific supportive therapy means adjuvants. What is cycloplegic drugs can be given, vitamins can be given, systemic analogs and NSAIDs also given for decreasing the pain. Pain will be present in the symptoms of corneal ulcer. For decreasing pain, we can give an NSAIDs. We can give for healing process. We can give vitamins like A, B, C. For cycloplegic drugs should be given. When we give an atropine, it increase the blood supply to uvea, increase immunity and increase antibodies to aqueous humor and decrease the ciliary spasm, decrease hyperemia. All this can helpful by using the atropine. Okay. Next, physical and general measures like hot fermentation, dark googles can be given. So this is the general treatment. First of all, what is the treatment? Antibiotics. In antibiotics, we can given fortified TVC, tobramycin, vancomycin. C means cephazolline. These are the important. These are fortified. After that, you can write the adjuvant therapy like atropine for pain, NSAIDs and analogs. And next, vitamins for healing. Okay. For this therapy, if there is any non-healing treatment, non-healing corneal ulcer, how you can treat? See, remove any known cause of knowledge. Why the non-healing occurs? Then you should know the cause, then remove it. Like how to the something, if diabetes mellitus, it leads to non-healing will not occur. Anemia, because of no blood, it leads to non-healing. Any foreign body, again any foreign body is present in it, and wrong diagnosis, diagnosis status, all these occurs because of non-healing. So we should know the cause. We should remove the cause. After the cause, we can take the again debridement of ulcer, scarping floor of the ulcer. Next, cauterization of ulcer performed with pure carbolic acid. After that, bandage, soft contact ulcer, and peritomy also done. Peritomy means when excessive corneal vascularization hindering healing will be occur. Because of excessive corneal vascularization, there leads to healing will be decreased because of excessive corneal ulcer. So first, why the non-healing will occur? First, we should know the cause. Next, we should use the mechanical debridement of ulcer. Next, cauterization, pure carbolic acid. Next, bandage, soft ulcers, and peritomy. This is the non-healing ulcer treatment. Next, treatment of impending ulcer and perforated corneal ulcer. Impending ulcer. In impending ulcer, we should use PTK, penetrating therapeutic keratoplasty. What is the surgery? Penetrating the therapeutic keratoplasty or any transplantation membrane like amniotic membrane. Amniotic membrane transplantation technique and pressure bandage, decreased IOP. All this should be done under because of why the perforation occur, because of increased IOP. So we should decrease the IOP. Okay. If we prevent the perforation, we can use the soft contact lenses. First one, perforation occurs because of any straining, stitching, so we should prevent the straining, stitching, coughing. And next surgery is PTK, perforation therapeutic keratoplasty is done for impending perforation. Next, perforated corneal ulcers. Best to prevent perforated corneal ulcer is same PTK, penetrating therapeutic keratoplasty. We can use bandages, glues, soft contact lenses. So surgery, you should remember surgery like PTK, penetrating therapeutic keratoplasty for perforating or impending corneal ulcer. So this is the summary of treatment. So first of all, they will ask the treatment mark, then you should write the antibiotics. Very important antibiotics. Okay. For all these are fortified. Fortified TVC means tobramycin, vancomycin, cephaloxolin. 5%, 15%, 1.3%. Sorry, 1.3%. Next 5% also. Okay. Next, adjacent therapy, atropine for pain, NSAIDs for vitamins. Next, prevention for physical general measures like hot fermentation, to decrease the pain, and dark googles prevent photophobia. All this for non-healing, first you should know the cause, why it, any diabetes, any anemia patient, any diagnosis patients, wrong diagnosis of foreign body, it leads to non-healing. Next we should use a debridement. Next, cauterization, bandage, soft contact lenses, and peritomy should be done. In peritomy, excessive vascularization is present, then the healing undergoes hindering. Next, impending perforation and perforated corneal perforation. Impending perforation, all these should be given like bandages, pressure bandages, soft lenses, this tissue glue should be given. And for decreasing IOP, you can give an estrogen, mannitol, all this given. What are the treatment like? Surgery like PTK, penetrating therapeutic keratoplasty. Same treatment should be given in perforated corneal ulcer also, along with these glues, flap, and contact lenses also. So this is the bacterial corneal ulcer total question for university exam. Please, it is an important question. Please please read thoroughly, and you should remember about this corneal ulcer, um, all the points. Okay, thank you. Please subscribe my channel and please support us. Thank you.